This video on drug ad questions. I know this is a highly requested topic. I took my good time trying to understand this. This is something that baffles all of us, really. But this is my attempt to simplify it as much as possible, give you my approach to solving these questions, and hoping to just make this slightly easier for you guys. So what we have right here is a drug ad question. This is just one. I'm going to add multiple in this series that I have on biostats and epidemiology, made easy for you to review. So right now I'm going to first explain to you the approach to a drug ad question. Right. So when you get a drug ad question in a combination of like 38, 39 questions, right off the bat, it really baffles you. It really gets you. This is going to waste a lot of my time. So how I do it is I go straight to the questions first. Let's say I skim through this, I don't read it exactly, I just look at it a little bit, and then I go to the question. And before I even read the question's vignette, I go directly to the question itself, which is basically this. According to the above drug advertisement, which one of the following is the most appropriate recommendation in this patient? And then we have a lot of recommendation. You start glucobalance at the lowest dose and monitor kidney function. So kidney function might be something that we need to consider in this drug ad. Avoid glucobalance due to the risk of pancreatitis recurrence. Pancreatitis recurrence might be something that we need to take a look at. And then switch to an SGLT2 inhibitor to reduce cardiovascular risk. Cardiovascular risk, SGLT2 inhibitor. We want to see this if we get some information according to this in the question. Add basal insulin instead of glucobalance. Got it. Start glucobalance but monitor for hypoglycemia. So right off the bat, we have a couple of things. We have information what exactly to look for in this drug ad. And then read the second question. Which one of the following limitation most affects the external validity of this balance 1 study? Okay, then we have all of these options, right? We don't need to read all of these. Small sample size, selection bias, limited ethnic diversity in the trial population, wide confidence interval, high loss to follow up. Great. Now we understand the second question as well. What is affecting the external validity of this study? Which one of the following patients would be the best candidates for a glucobalance trademark? So this is the bad one question, right? This is the bad question. This is the one that you really need to understand and read the whole drug ad for you to be able to solve this particular question. Therefore, let's just go back and solve with the first question that we have. According to the drug advertisement, which is the most appropriate recommendation for this patient? Remember, you're going to do this really fast. Go through the questions, quickly read through the questions, see the options, and then go back to the drug ad. So first of all, what is the most appropriate recommendation? So you want to start, switch to something else, or start glucobalance. So what patient do we have? So we have a 62-year-old man with type 2 diabetes mellitus who is presenting for a follow-up. He has been on metformin 1000 BD for the past 3 years and has not achieved adequate glycemic control. So his HbA1c is high. He has a history of hypertension, CKD. Again, we read something about kidneys in the options as well. So, and his EGFR is 45, and he has previous episode of pancreatitis. Again, pancreatitis, we saw that in one of the options. He denies alcohol use. BP is fine. Heart rate is fine. BMI is high. We have bad creatinine, again, because he has CKD. EGFR of 45. LDL is fine. HDL is okay-ish. Triglycerides could be lower, and then HbA1c is definitely bad, and the physician is considering adding glucobalance. So let's go and see if this patient has any particular contraindications to the use of this drug. We know that this patient has CKD, we know this patient is hypertensive, we know this patient has had an episode of pancreatitis as well. So let's go to our drug ad questions, and right off the bat, we can just read a little bit of this. Glucobalance is a novel combination of metformin and dulagliptin. These are two treatments for not really important, for the treatment of type 2 diabetes mellitus. You don't need to care about the mechanism of action. And then this is a randomized controlled clinical trial data. This might be relevant to our second question, which was what limits the external validity of this drug, of this study. And then we have like 5,200 participants. These are all the outcomes. We don't really care about these right now. So right now we want to see if we can start this person on this drug or not, or is this person contraindicated to the use of this drug. What are the adverse effects? Nausea. And first of all, we want to see something. If you see an adverse effect, see if it's significant or not, right? in this case it is significant. P-value less than 0.05 in most cases for your exam is going to be significant, unless they want to state some other some other level of significance. But most of the time, if it's less than 0.05, it's going to be significant. So nausea is significant. This is the risk ratio. It's higher in the glucobalance group. And again, diarrhea, it's higher in the glucobalance group with a risk ratio of 1.57. Pancreatitis, again, pancreatitis. We knew that our patient has pancreatitis. That is bad. So does this have the recurrence of pancreatitis? So acute kidney injury, okay. But this has a protective effect. This is 1.5 in the glucobalance group, and metformin, that is good because our patient is a CKD patient. We know that he had a creatinine of 1.4 and an eGFR of 45. So this might be good for our patient, and a risk ratio of 0.42. That means, and this you look at the confidence interval as well. When you look at the p-value, also look at the confidence interval. Confidence interval in cases of risk ratio, in cases of ratios like odds ratio, in cases of hazard ratio, should not include the value of 1. If it includes, if this was 0.32 to 1.32, this would have not been significant. But this in case is significant, and it's less than 1, is therefore protective of acute kidney injury. So it cannot cause, it will actually be protective of acute kidney injury. And then heart failure exacerbation. Does our patient have heart failure? Our patient did not have anything relating to heart failure, right? So we didn't have any history of heart failure. What are the black box warning? Increased risk of recurrent pancreatitis. Remember, our patient had an episode of pancreatitis. We don't want to cause him pancreatitis again. That is bad. DKA recurrence. Our patient has not had DKA yet. And then heart failure exacerbation. Study has minimal loss to follow-up, which was adjusted in the analysis. That's really good for the study. eGFR, use in cautions in patients with eGFR less than 30. Our patient had way above 30, which was around 45, and symptomatic heart failure. So what's the black box warning? Our patient has had pancreatitis. Therefore, we know we cannot start the patient on this medication. So let's go and read the options now. And I just want to check if they had DKA or not. So we don't have anything like DKA in the history. Right. So let's read the options. Start glucobalance but monitor for hypoglycemia. Well, we know that we saw hypoglycemia in the adverse effects, but we can't start glucobalance. I don't think we can start glucobalance because this patient has had pancreatitis. So not this option. Add basal insulin instead of glucobalance. We don't know if this is the correct option right now. Why? Because we didn't read anything of this sort in the drug ad. So right now, let's just, we can put this question a little bit, we can think if this is a little bit questionable. We can put a question mark in front of this. And then switch to an SGLT2 inhibitor to reduce cardiovascular risk. Well, this patient does have cardiovascular risk, but we're not exactly sure about this option because we had nothing of this sort. This drug ad is particularly for diabetes management. This patient has uncontrolled diabetes of 8.3% HbA1c, so we're not sure about this option. Avoid glucobalance because of risk of pancreatitis recurrence. I think this is the correct option. That is a contraindication, a black box warning. We read it in the drug ad. Therefore, for this question, B is the correct answer. Remember, for these questions, you're going to do a lot of back and forth. Let's read the first question as well. Start glucobalance at the lowest dose and monitor kidney function. We know that this is not the correct option. We can't start glucobalance because this patient has the pancreatitis recurrence. Remember, both of these options are not wrong, but they're just not the best option. The best option in this case is going to be B. It's going to be B. Remember. So let's go down. Let's go to the second question and see what we read there. So let's talk about the second question here. We knew that this relates to the external validity of this study. The external validity. What is the external validity? External validity just basically means you did a small study on a group of, let's say, Asian people, and now you say the results of this study was basically checking the IQ of this group of Asian peoples, and which turned out to be very, very high. And now you said the IQ of all the Asian people is very, very smart, is very, very high. Basically, external validity just means that my study applies to everyone. My study applies to everyone. And what does that depend on? Basically, you took a population, in this study, you took a group that was representative of the whole population. There was no selection bias in the study. So this group is very similar to the actual population. This was chosen randomly. So therefore, that is the external validity. What is the internal validity? Internal validity is how well your study was conducted, how well you controlled for all the other factors, and how well you established the relationship between the exposure and the outcome. So which of the following most affects the external validity of the balance 1 study? Small sample size, we know that is not applicable because this study has a sample size of almost 5200 people, therefore this is the wrong option here. Then selection bias due to non-randomized design, this was a cluster randomized trial, we talked about that. Limited ethnic diversity in the trial population, we're not exactly sure about this option, so we can move towards D. Wide confidence intervals for all the outcome. Remember, confidence intervals being narrow or wide affects the internal validity. It shows you whether whenever you have a smaller sample size, you tend to have, or a lot of variability in the study itself, a lot of variability in the data, you have a wider confidence interval, which affects the internal validity of the drug, of the trial, not the external validity. External validity basically depends on whether the population that you chose was similar to the actual population or not. For example, if you're conducting a study on African American patients, whether you actually took African American patients that are similar to the population, or you took white people, or you took Asian people, or you took other ethnic populations. So this does not, wide confidence interval does not affect the external validity. High loss to follow-up. We know that this study did not have a high loss to follow-up because it was written in the study that we had almost minimal loss to follow-up. So this is actually the correct option. If this study had limited ethnic diversity, if this study had a very small subset of people, for example, if this study was conducted in an Asian classroom and now you want to apply the effects of this study in the whole world, then the external validity of this study is actually affected. It's not very externally valid. Therefore, C is the correct option here. Let's talk about the third question here, which is, which of the following patients would be the best candidate for glucobalance? So for this question, I think we're going to have to go back and look at the adverse effects and look at the contraindications, because if we know the contraindications, then right off the bat we can just exclude those people. People with symptomatic heart failure, so we use in caution in these patients, and people in EGFR less than 30. Whenever you have something like use in caution in these black box warnings, adverse effects, use in caution, think of that more of like a contraindication. They want you to see this and say that this patient is not right for this drug. So we're not going to use this drug in people with symptomatic heart failure, people with EGFR less than 30 and chronic kidney disease, and people with recurrent pancreatitis, heart failure exacerbation, and DKA recurrence. So now, which of the following candidates would be the best for this study, for this drug? So people with type 2 diabetes mellitus, okay. HbA1c 8.5, okay, and NIHA class 3 heart failure. This does not work. This is wrong. And then we knew that this is one of the contraindications. Type 2 obesity, that's fine, and recurrent pancreatitis. We knew that that is one of the contraindications. That does not work. Again, 55-year-old man with type 2, EGFR 25. We knew that less than 30, this drug does not work really well. And then type 2 diabetes mellitus, HbA1c 8.1, and hypertension, okay, that works pretty well. And 58-year-old man with type 2 HbA1c 7.9% and history of DKA. We knew that a history of DKA or DKA recurrence was one of the side effects, was one of the black box warnings, so this is not applicable. So the correct option here would have to be D. And that's how you go about a drug ad question. You go to the questions directly, you read all of them, you read exactly what they're looking for, and then there's a lot of back and forth between the drug ad and the actual questions. And whenever you look at the drug ad, whenever you have the outcomes, you have the adverse effects, remember to always read the confidence interval, the risk ratios, whether the confidence interval includes the null value, which for risk ratio and odds ratio and hazard ratio might be 1. And you always remember to read the p-value, whether the p-value is small or not, whether those results are significant or not. Like in this case, this result is not significant. 1, because it includes the value of null value in the risk ratio, which is 0.9 to 1.97. It includes the value of 1, and also because it's greater than 0.05. And that is a drug ad question for you. So in the end, thank you so much for watching this video. This video is going to be a part of our series on biostats and epidemiology made easy. I have made videos on each one of these concepts in detail if you have some basic concepts that you need to study on. So go back, watch that video, and I'm gonna add a link to this drug ad with some additional questions as well in the description for you to study yourself. Thank you so much.